Hello there. So, welcome to another episode of the She Health series. My name is Dr. Sida Ikanem, and this is my social impact project under the auspices of Excellence in Medicine Ladies Network and M1 Lagos Mentorship Program. So, today I'm going to be talking about 5 common areas that most women ignore and why you shouldn't, cracking the code to feminine hygiene. If this sounds like something that would interest you, then I want you to stick around for more. Thank you for sticking around. So, I get to attend to a lot of women on a daily basis, and I've come to realize that these 5 body areas are usually not given the right amount of care they should receive. I'm sure you're wondering what exactly are these body areas, what most women are doing one or what most women are overlooking. Number one is the breast. It is so important that every woman schedules a monthly breast examination so that you can know what is normal for you and seek care when you notice something going off, or so you can seek care in time when you notice something going on. I'm going to add a link to that video so you can see how to do is know how to do a self breast examination. The second area most women ignore or do not give the appropriate care they should is under the bust. Now, because this area, depending on the size of the breast, this area is usually hidden out of sight, and because of that, it can be an area that traps moisture. Now, when there's moisture, it will encourage the growth of harmful bacteria and lead to fungal skin infections, most especially Candida intertrigo. This is a picture of how Candida infections look, and I noticed that most women, a lot of women have this particular skin problem because that area is left wet, and because of that fungi grows and causes the skin changes. So it's important that you make sure after you have a bath, make sure that you pat this area dry and use moisturizers or oils to make sure that fungi does not grow and cause problems like in the picture I have just attached to this video. All right, so moving on, the second area I feel most women ignore is the groin area. This is the area between your, and this is the area between the private area and the thighs. And because of the way it is designed, this area can also trap moisture and encourage the overgrowth of harmful bacteria and cause a particular fungal infection called tinea cruris. And this is how it looks. I noticed that once, and when I'm examining most women have this particular lesions. Most don't even know that it's abnormal to have them because they've had them for the longest of time, right? But this is actually skin infection, and it is important that to avoid this, make sure that the groin area is cleaned dry after a bath. Make sure you use the oils or moisturizers of your choice to keep that area moisturized and also serve as a barrier to moisture, and thereby preventing overgrowth of fungi and fungal infection. Also, if you notice that you have this particular skin changes around this area, you could meet your doctor about it. Your doctor will give you the right medication, usually topical medication, antifungal medication to apply there once or twice daily for a period of some weeks to just make sure that area is cleared and healed. All right. I hope this video is interesting you so far. If it is, please do the following for me. Leave a like, drop a comment, and share this video to someone who may find it very useful. All right. Now, the third area we're going to look at is the buttock area. In medical terms, is the gluteal area. Now, this area is designed to have a cleft dividing one buttock from the other or one gluteus from the other. Now, because it is a cleft, it's usually out of sight. Most women usually overlook this area because they can't see it, but just like the groin, it can also trap moisture, and with moisture there could be overgrowth of fungi or other harmful bacteria that could lead to skin changes that you would not like. And usually because this area is out of sight, most women would not notice, but if you notice, you realize that this area is always itchy, you know, you do always feel uncomfortable, then probably you could just be having a skin infection in the gluteal area. And again, what do you do? After every bath, make sure that you pat this area dry. Make sure that it is moisturized all the time so that you don't encourage the growth of fungi to leave skin changes like redness, reddening, or itching, or even scaling off. all these signs or signs I've mentioned usually will suggest that that could be bacterial infection or suggest that that could be a fungal infection. Okay, so I hope that you're taking note of these tips I'm leaving down. Okay, so the fourth area is the vulva. All right, the fourth area is the vulva. Now, permit me to use this tissue just to cite an example. So you can see that there's a green area, right? The green area, that's the vulva area, comprises of the labia majora, which is the outer area you see, and the labia minora, which is the inner area. So I'm just going to fold it like so, so that it can just have a semblance of what we have outside. Okay, something like this. All right. Yeah. So for most women do a lot of things around this area. I've heard a lot of things like vaginal steaming or vulva steaming or whatever. Well, I'm going to talk about that in another video. But for this video, it's recommended that all you need to do to keep this area clean is to wash with soap and water. That is about it. Now, because it comprises of the labia minora, this outer area that this green handkerchief would depict, and the labia minora, which this white area would depict, it's important that when you're cleaning up, you clean around the area, wash around this area, and also wash around this area. Okay, for most women, there's a cleft between the labia minora and the majora is actually very pronounced. So if you don't watch wash area very well, you find out that a lot of smog or whatever, you know, secretions could just be stuck there, and they could just serve as a focus for infection. Okay, and it could cause itching and change in the color of the skin, and you wouldn't want that, right? So make sure that when you're washing this area, wash the outer area, the labia minora. And if the, it's your there's a cleft here that is pronounced for you, make sure you wash this outer area as well. Okay. Now, number five is the vagina. Okay, so like I said before, I hear a lot, and because most women really want to keep this area clean, they resort to douching. Douching is the or douching. I don't know how you would pronounce it. So douching is the use of usually fluids, herbs and antiseptics to wash out or rinse out in the inside of the vagina. Now, these two handkerchiefs I have here, let this be a model and let this area here represent the vagina. Now, it is not recommended. Du- Douching is not recommended. I'm going to repeat myself again. Douching is not recommended because when you douche with fluids, herbs, or antiseptics, what will happen is that it will distort the acid base balance of the vagina. The acid base balance of the vagina is designed to help the body fight intruders or fight intruding organisms. So for women who are practicing douching, this will disrupt the acid base balance and predispose them to having repeated infections like bacterial vaginosis and candida. Also increasing the risk of contracting sexually transmitted infections because the acid base balance is not at the right pH to fight intruding organisms. So these women find that they always have to treat one infection or the other just because of douching. So you see, douching is not recommended. How do you keep the vagina clean? You just leave it alone. The vagina knows how to take care of itself. It knows how to ensure that it's kept fresh and clean. It's common for women to see some secretion or discharge from the vagina. That is actually normally okay. But the kind of discharge that should make you worried, however, is if you notice discharge that has a foul smell, has a yellowish or greenish color, or you note any discomfort or itching, that is abnormal and it should be treated. All right, so that's about it. I've come to the end of this video. If you found this video interesting, I want you to do the following: leave a like, drop a comment, subscribe to my channel, and share this video to as many women as you know. They'll be grateful that you did. I'm going to be coming back again with another interesting topic. Until then, I want you to stay healthy. Dr. Cedar cares. Bye bye.